Well, thank you, Mr. Chair, and thank you and the ranking member for holding this hearing. Thank you to all the witnesses for your work to meet the current unprecedented challenges that our nation's children and educators are facing. And just before my questions, I also want to associate myself with the remarks of our ranking member about the ongoing work we need to do to address issues of institutional racism throughout our country and how important our education system is as part of that effort. Dr. King, I want to direct my first question to you. As Congress has worked to respond to COVID-19, I've advocated for additional funding and flexibility for state and local governments to help backfill their budget shortfalls. And budget shortfalls have been mentioned by all of the witnesses here. We know that some of the greatest implications of these shortfalls will be on school budgets at a time when schools are being asked to completely rework education delivery and address student learning loss. So, Dr. King, do you agree that Congress should prioritize getting states and local governments the support that they need so that educators have the necessary tools to meet student needs at this critical time?
It's absolutely essential, Senator, that Congress put additional resources towards state stabilization dedicated to education. We've called for at least $175 billion just to make sure that districts don't have to make devastating cuts to personnel and programs. We need additional funds on top of that to address learning loss and socio-emotional needs. But those state stabilization dollars are vital. We saw this during the Great Recession, that districts all over the country lost personnel, lost programs, and the consequences were worse for the students who are most vulnerable, low-income students, students of color.
Thank you. I certainly hope that we have bipartisan effort, as Senator Cassidy was talking about it as well, to do just that. I also want to talk to you about another particular group of students that face unique challenges during this crisis, and really following up on Senators Casey and Murphy on this issue. At a time when we have to meet the needs of all of our students who have struggled to access a quality education during remote learning, students who experience disabilities have been disproportionately impacted by changes to education delivery necessitated by COVID-19, and you've spoken about that. Under the IDEA, students who experience disabilities have a right to access the same educational opportunities as their peers, but that's been particularly difficult as schools have shifted from in-person to remote learning. In many cases, these disruptions will result in students with disabilities experiencing learning loss and missing the education goals outlined in their individualized education plans. Dr. King, as schools experience increased demands to respond to COVID-19, can you please speak to the value of Congress providing additional dedicated funding for the IDEA?
Yeah. We already know that for many school districts, they are not getting nearly the level of IDEA funding they need to provide services, and they're very reliant on local dollars. As states deal with budget cuts, it will be even more challenging for them to ensure that they're serving students well. Some of the things they'll need, we know assistive technology will be vital for some students to be able to access distance learning. We know that in some cases, additional staff will be needed in order to be able to potentially provide services at home to students in a socially distant way that might get supports to those students. Parents need additional support. In many cases, parents are very reliant on school to help them support students, particularly those with the most significant disabilities. And they'll need more support, socio-emotional support, as well as the instructional support for their kids. So this is a critical area. We got to make up for what students have lost, and we've got to be in a position to support students in what may be a distance learning or hybrid learning environment into the school year.
Well, thank you for that. And I wanted to ask Commissioner Schwinn and Blomstead a question as well. We've talked about all the different things that we're going to need to do to get our schools ready for students to return there physically. But we know that even in places where public health officials believe that schools can safely reopen, some families that face increased health risks at home may feel uncomfortable with their child going back to school until there's a COVID-19 vaccine. So can you share how your own state school reopening plans address the needs of students who may request to continue remote learning due to ongoing health concerns?
Yeah, and actually, it's been a very important conversation across the state that, again, I kind of go back to my people first approach, right? That when students are asking and families are feeling that it's not safe, we want to make sure that there are protocols in place. If they can't feel safe in that environment or they have real medical conditions that are a big concern for that family, especially students with disabilities that we know have medical vulnerabilities on top of this, we want schools to be accommodating for all of those different settings. We want to find unique ways. We're asking schools to find those unique ways and work with parents on IEP plans and work with them relative to each plan and each individual concern that parents may have. And so we see that taking place across the state. It's a lot more to do, and we'll probably have challenges yet, like we always may experience. But from my perspective and from our philosophy at the state, we need to be working with each of them on those concerns.
Thank you. Commissioner Schwinn, do you have anything to add? I know I'm over time.
Yeah, I'll be brief. I think we've prioritized this work in Tennessee. We put out a 60-plus page LEA guide, and we're putting out 20-plus toolkits over the next 7 days, specifically on issues like this. But we've prioritized children with disabilities, a $5 million compensatory education fund for our districts, $1 million in assistive technology, and $3 million plus in innovative grants so districts get supports they need, specifically for students who are unable to return to school.
Thank you very much. Thank you to
Yes,
all
ma'am.
of the witnesses, and thank you, Mr. Chair.